What I'm currently seeing are 5 major trends that I quickly want to allude on. Number one, we see patient and consumer more and more in the center. And as you for sure know, SAP has 25 industries, and we are also in consumer and other industries that are tackled by consumers. Secondly, I found it very important, clearly, that outcomes are very important for our patients out there. It's not the service, it's not the things that are provided, it's really about the outcome that is important for you as a patient. Secondly, I would also look at the workforce. We see with the technology that SAP provides that the workforce is going to change, so the doctors and the nurses are going to be relieved from their, let's say, boring stuff, but rather can focus on the patient at the end of the day. And data-driven clinical innovation, that's what we are seeing in cancer care, for instance, that's what we're seeing in Alzheimer and in diabetes, where we're using data from an SAP standpoint to really create new treatment methods and to understand the disease much better. And last but not least, might be boring for one or the other, it's also optimizing the processes from, on the one side, from the clinical standpoint to patient billing and also to financials and to materials management.
Martin, I hear you, and look, it's irrefutable that these are brilliant trends which are going to, as you say, release the healthcare professionals from the boring stuff, but they're also going to hand a lot of the input of the boring stuff over to the patient or people who are working with the patient who are less qualified than these stunningly qualified doctors and nurses as well. There could be a lot of medical errors on this side as well if we're getting people who, let's be honest, like me and others who don't know medical processes, who aren't aware of the importance of certain inputs. Handing it to us is quite dangerous, isn't it?
Yeah, so first of all, even the patients, I would say, become more and more experienced. So, but I'm with you. We need to be careful that the data is not used in a, unspecific context. So therefore, I'm, not a big fan to just throw, let's say, a treatment proposal at a physician, but rather come up with the information that the physician needs at this particular point, or can help him if he forgot a specific treatment, for instance, that he can go back and does it with a patient. So I'm totally with you on that point. Patient safety is at most importance also from an SAP standpoint. That's totally clear.
Hey everybody, it's Hadley Gamble from our new CNBC Middle East Bureau in Abu Dhabi. Thanks for stopping by. Now to watch more, you can try one of the videos that just popped up on your screen. And don't forget to subscribe.